face, you typically don't need any oil at all. So when you're using the face massage, you can just start by just placing your hands on them for a moment. You just really don't want to go into the massage right away to start off with, but just place your hands on them, make sure they feel comfortable with you, and then you can start a little bit with the massage then. And with the massage, again, especially pregnant women, they tend to excrete a little bit more oil, especially in the face region. So you don't need any oil then. And if they do want anything, you can possibly use some lotion then, or jojoba oil. It's more of a paraffin based. So we're going to start by the forehead area. Kind of separate. And most of the times you want to perform techniques at least 3 times. You can just kind of come up the head area. You can go right underneath here. But if a pregnant woman, if they're feeling a little bit nauseous, that's why being elevated helps out. Don't get too close to the eyes, of course. You kind of go around. And pregnant women, they tend to get a little bit hotter than the average public. So you can offer heating blankets, but more than likely they won't use it. But just have those options available just in case then. And you can even go along the jawline. And every now and then ask permission about the pressure. So if you use less pressure, or if they want more pressure. And it's always a good idea to get a health history of the pregnant woman before you start. Make sure they're not high risk at all. And if they are high risk, make sure you get permission from a doctor before you proceed then any further. And you can even use both palms, even going down, but just try not to cover the ear and hold it all. It's just a weird sensation. You can even go into the scalp region. You can even separate a little bit with like the thumbs. For my wife, when she has a hard time sleeping at night, this is one thing that usually knocks her out. Just massaging your scalp. About 80% of the nervous system runs through the scalp region. That's why it feels so good for most people. And you can even just give a little pull, especially if they have longer hair too. You can even hold on to it a little bit and just give a little pull too. But if they have thinner hair, try not to use that technique too much, because it might hurt them a little bit more. And with the ears, you can even kind of massage around the ears or on the ears. You can kind of friction and even kind of separate the ears too. But right behind the ears, and if you need to, you can kind of rotate the head and really get in there. And this is a big area for headaches. And pregnant women, again, they tend to have a lot more aches and pains than the average public. And if you're performing any deeper work, make sure you go a little bit slower. So the deeper, the slower. You can use your knuckles in this area too. You can even glide up the hair a little bit too with the knuckles. with a pregnant woman, just make sure that they're breathing okay. I mean, they're going to be more upper chest breathing, but just make sure they feel comfortable in this position. And if they need to, you can tell them every now and then that you can move around or move in a different position if you need to. But whatever you perform on one side, just make sure you perform it on the other side too. But for this video, we're not going to even things out as much, so we're just mostly one side. But again, in a real massage, you want to make sure you even things out on both sides equally. You can kind of hook the suboccipital ridge here. Just give a little pull. And you can perform some neck stretches too. Make sure you don't cover the ear. Just going to stretch. And whenever you perform on one side, make sure you perform it on the other side too. And you can perform some like neck flexion, like this and this, and just kind of lift up. And you're pushing down on the shoulders here. But for a pregnant woman, just make sure that they're breathing okay, because if they are a little bit larger chested, the milk's starting to flow, they can be cut off circulation a little bit when they're breathing. So just be aware of that area then when you're stretching out their neck. I know it feels good, but it might be better just to perform some traction instead. So not the actual neck flexion like this then. And you can perform it both at the same time if you want. Just kind of go down the neck area. And the moneymaker technique, right here at the shoulders. Most people love this area. Especially women, they tend to have a little bit more problems in the shoulder region compared to males. And with women that carry their purses, and mostly on one shoulder, that's when they're going to have problems there. Or if you're in a profession where you're on the phone a lot, you're going to have a lot of problems there too, because the shoulder's going to be elevated more. And you can even go underneath like this, squeeze. You can kind of rotate and kind of rock the head a little bit. And just don't perform this fast at all. You don't want them to feel dizzy or nauseous at all. And when you're massaging a pregnant woman, it's always a good idea to ask them to go to the bathroom before you start the treatment. Because the farther along they are, more likely they're going to have to urinate a lot more too. But I myself, I usually schedule at least an hour and a half, or maybe even an hour and 15 minutes for an hour massage. So the client, if they need to, they can get up in the middle of the treatment and use the bathroom then. And when they're in the end of the third trimester, that's when they're more likely going to be urinating a lot more, because when the baby starts to drop. And also with pregnant women too, their shoulders tend to be a little bit more internally rotated, so rotated in like this. So that's why the pec area, concentrate on a little bit more. You can use your knuckles. And you can even do a little stretch. So you're going to kind of push down to help open up that area then, is what you're trying to do. Again, kind of lean in, kind of stretch. And this area might be a little bit tender too, especially at the end of the third trimester. It's going to be a little bit more tender. And in the first trimester, that's why some women know that they're pregnant, is their breast area tends to be a lot more tender. So if it's a regular client and they said that it's uncomfortable for them to lay in the prone position, you might want to ask them, do you think you might be pregnant at all, if it's really discomfort for the breast area? But just be careful how you bring that up, okay? Okay, now I'm going to add a little bit of oil. Always make sure you warm up the oil beforehand. This makes it a little bit easier so you can perform some gliding. Because if you're not using the oil, you have to perform more compression techniques. And you can even go underneath the shoulder area and even slide underneath a little bit more. And remember, with the body cushion, there's a little bit of a dip in there, so that's why you can get your hands underneath there so much easier. And again, some people will use this body cushion for the average public too. So it's not just for pregnant women. You can kind of bring it over, kind of glide down, again kind of glide up, again glide down, and kind of give a little pull, and kind of rotate it around like that. But again, in a regular massage treatment, make sure you even out both sides evenly. And it all depends on what they feel comfortable with. If they feel comfortable with a little bit of oil in their hair, it actually feels really good. But it all depends on what they're going to do afterwards. Or if they have access to a shower afterwards too. You can use your knuckles even.